What are fontanelles in infant anatomy? Imagine a baby's skull as a puzzle made of several pieces that haven't yet snapped together fully. That's because the skull needs to be flexible enough to fit through the birth canal. These soft spots are called fontanelles, and they are made of flexible, fibrous tissue instead of bone. They are located between the skull bones and are essential for both birth and growth. When a baby is born, the skull is not completely fused. The bones are separated by these gaps, which are the fontanelles. The largest one is called the anterior fontanelle. It is diamond-shaped and sits at the top front of the skull where the two frontal bones and two parietal bones meet. This fontanelle stays open longer, usually until about 1 year and 2 months old, to allow the brain to grow. Another important fontanelle is the posterior fontanelle. It is smaller and located at the back of the skull where the parietal bones meet the occipital bone. It typically closes much earlier, often by 1 to 2 months after birth. There are also smaller fontanelles called sphenoid and mastoid fontanelles, which close within the first year. These gaps are not just for birth. They also give the skull some flexibility to expand as the baby's brain develops rapidly. Without these gaps, the skull would be too rigid to accommodate the growth. As the baby grows, the bones gradually fuse along the sutures, which are the fibrous joints connecting the skull bones. This process is called ossification, and it turns the fontanelles into solid bone. Doctors check the fontanelles regularly because their size and tension can tell a lot about the baby's health. For example, a bulging fontanelle might mean increased pressure inside the skull, while a sunken one could suggest dehydration. The soft spots also help with the baby's head passing through the birth canal, making delivery easier. In the end, fontanelles are a vital part of the infant's skull and overall development. They support the growth of the brain and help protect it during the early stages of life. Once the bones fully fuse, the skull becomes a strong, protective shell that supports and safeguards the brain, which is a key part of the skeletal system and the body's control and support systems.